Welcome back to Voices in Health and Wellness. This is the podcast where we spotlight leaders in healthcare who are balancing patient care with the challenges of running a modern practice. Today, I'm joined by Dr. Alesia Walsh, a pediatric dentist and the founder of Sprout Pediatric Dental in Lake Oriel in Pennsylvania. Alicia's journey is nothing short of inspiring. She overcame a battle with ovarian cancer during dental school, and that resilience has carried into her work today, where she's dedicated to serving families in her community, including many from underserved and low-income backgrounds. Alesia, thank you so much for joining us and welcome to the show.
Thank you. Thank you for having me.
Lovely. So maybe we could start at the top. Could you share a little bit about your role at Sprout Pediatric Dental and what inspired you to launch your own practice?
Yeah, so I am a pediatric dentist. This is my hometown that I'm back practicing in. I grew up in this Scranton, Northeastern Pennsylvania area and moved to Philadelphia for dental school for my training, residency, all that. And, when I came out of school looking for a job, I kind of wanted to stay in the big city, but there was something that felt compelling to move back to my hometown and serve that population. And I met my now partner and a close friend and colleague, Dr. Katie Slosher. She had a small office in the area. And as I was moving, would potentially move back, she was opening a larger office. So it just seemed to work very natural that, two doctors, bigger office, serve more patients. So I ended up moving back home to serve this population. And that was right in August of 2019. So right as I was getting, my sedation and my hospital privileges and everything worked out, we kind of hit COVID times then that spring. And that was just really eye-opening at the need that this area had for a healthcare provider and just the complete lack of access to care, kind of compared to being in Philadelphia. No children's hospitals, not a lot of providers that would do in-office sedation. So I feel like that's where I really saw the need. And then once we reopened after COVID, there was just this huge backlog of patients that hadn't been seen, procedures that we had been putting off, but then also children that had been home, had different diets, more grazing, eating, snacking throughout the day. And that put this population at a higher risk for developing cavities. So all of that kind of combined in a year created this just large number of children that had these immense dental needs. There were two of us, maybe 15 or 20 hygienists and assistants. And we realized that we couldn't really do it on our own. So we really started networking with our residency, meeting doctors at conferences, national conferences, finding people who shared our same values, just of this empathy, this high quality care, and serving a population. We see a lot of Medicaid, state insurance patients, but we also see a lot of private patients, private insurances, self-pay. And the biggest thing in our model is that every child is treated the same. So, we see a lot of patients a day. We're very efficient in our scheduling, but it kind of grew beyond us. So in the last couple of years, we've brought on 7 other pediatric dentists, and our staff has grown to now we have just under 100 employees. We have a human resources department now to manage our employees versus the doctors doing it, so that we are really able to focus on patient care and doctor things, being a doctor rather than just those business owner components, and standardizing protocols, being as efficient as possible, keeping up with the latest technology, incorporating AI whenever we can, just to deliver this high quality care to patients that are in need of it.
It's amazing what you've created. I'm super impressed. Would you mind taking us back a little bit further to dental school, if you would, and tell us a bit about how your cancer diagnosis shaped your outlook and your approach to dentistry? Because I know it was quite a sort of seminal time for you.
Yes. So I guess when I was in college, I felt like I was very achievement driven. I was a double major. I did the honors program. I wrote a thesis, it's like you go to college so you can go to dental school. You go to dental school so you can get a job. And everything felt like it was very structured. And I started dental school right after college. And after my first year of dental school, I was diagnosed with ovarian cancer, and it was stage 3. I had to have surgery. I had to have chemo. So I had to take a year off of school. And I kind of just did what I had to do to survive. And I didn't really think about the time that was passing really until after I was wrapping up chemo, and I kind of realized that my class had moved on without me and I would be starting into a new class. And obviously I'm happy that I had such a successful outcome. I had such amazing doctors and nurses and people looking out for me throughout the process so that I could really focus on my health. But I feel like one of the biggest, obviously, people that were impacted by this were my parents. And so when I returned to dental school, I kind of discovered the field of pediatric dentistry. I had some great mentors along the way. I did some mission trips in Peru and in Mexico for a couple summers. And so that really kind of solidified that just direct patient care, my love for pediatric dentistry. And I feel like pediatric dentistry, the biggest component that I can bring in for my cancer journey is obviously the way it feels to be treated as a patient, having been a patient, but it's not just the patient, it's the patient's family, it's the patient's parents, and it's having everyone feel comfortable and trusting and just knowing that their child is in good hands. So just kind of the big picture, treating everyone that's in the room, not just the child.
Got it. And in terms of that personal health journey that you've very kindly shared, I mean, how does it at the ground level influence how you connect with the patients and their parents? What is it that you do differently that you perhaps wouldn't have done had you not been through that?
That's a good question. That's a good question. I feel like I am very intuitive, and I feel like I've learned to rely on my intuition a lot, and just kind of reading the room and knowing what each parent, each grandparent that brings a child in needs. So it's 2 parts, right? I'm a pediatric dentist, so I treat baby teeth. And it's the kid being nervous in the chair and calming them down and helping them get over that anxiety so they have a good experience and they continue to like coming here and you're not screaming, crying, coming through the door. But then it's also the parent who entrusts their child's health to you, and they're scared and they feel responsible for the kids' cavities, or they don't want their kids to have bad experiences like maybe they had in the past. So it's just helping them to feel comfortable. And I guess like not overlooking that part. When I started as a pediatric dentist, I wasn't a parent. So I had to kind of get that like mom knowledge from somewhere. And I just look to my parents as examples of how they, helped make me feel comfortable, how they made decisions for me, how they felt comfortable with providers. So I just want all of the families that come into our doors to feel that comfortable feeling, that safety, that they're going to be getting the highest quality care, and I'm going to do whatever I have to do and do the best thing for the child. Every decision I make is for the best decision for the child. So whether they agree with my treatment plan or not, I'll kind of work with them a little bit to see if we can kind of find some middle ground sometimes. But ultimately, they know that what I do is for the best of the child.
Amazing. So what does a typical day look like for you at the moment? I know no 2 days in this world are going to be the same, but I'm trying to get a sense of, you've created this sort of massive operation with 100 staff. Obviously, there's clinical responsibilities, there's leadership responsibilities, there is probably some administrative, and I know you talked about you had other people to do some of this stuff, but what does your typical day look like for you at the moment?
I am at one of our 4 offices. We get our schedules kind of monthly. Typically, I'm scheduled in the mornings. I kind of get in a little bit later than the first doctor that comes in. So I primarily do these oral conscious sedation procedures. So I'm scheduled about 6 or 7 of them from 8 a.m. until 1 p.m. And I solely focus on those. The other doctor that's in the office with me, the other pediatric dentist, she runs the hygiene columns, the cleanings, the smaller operative procedures, which is great because it allows me to focus on the sedation and being safe and doing the best for the child. And so that's usually a half day. Then some days I will do admin work in the afternoon. Some days I'll see the hygiene patients and work with the other staff members kind of throughout the afternoon. We do a lot of like lunches with the leadership team that we've created. Each office, we're kind of, we take a hygienist who's been with us for a couple years, really knows our mission statement, really embodies our core values, and work with them through, maybe different challenges that they face throughout the day with managing staff and just kind of coaching, talking to them, a lot of that so that they can manage a lot of those more smaller issues so that, you're not constantly getting people at your door. Like, hey, I have a question. So-and-so said this, so-and-so's room wasn't stocked. Like people kind of, it doesn't get to us until it's like a bigger problem, which kind of helps us focus on the patients. So it's just a lot of like mentoring and things like that too throughout the day.
Cool. What are the biggest shifts you've seen in pediatric dentistry over the last few years?
I feel like pediatric dentistry is becoming kind of corporate. A lot of these smaller offices are being bought out by these dental service organizations, these DSOs, and essentially they're being run by, no offense to anybody, but individuals that don't always have a dental background, and so much as they have more of that like finance background, that business background, which is great. But to me, I feel like I like having the dentist background, the patient care background, and that's kind of what really guides our decisions, because the patients are there, the money comes, like all of that. And so not having production goals as your goal for the day, but rather having just like how many patients can we see in a day, because like this parent took 3 different public transportations and walked 2 miles to get here and it took them 2 hours. So can we accommodate them for treatment today? It's like, it's always doing things like that. And I feel like when a lot of the other models that I see, which is where pediatric dentistry is heading, don't always allow for a lot of flexibility like that, which our practice does allow for flexibility. And there's definitely a big shift with this like in-office sedation, general anesthesia. A lot of the rules are changing. So we're trying to keep up with things like that. But it's definitely a challenge for us being in this more rural area where patients don't have the access to care. The children's hospitals are 2 hours away. So they just can't get there.
So you'd want to resist that kind of corporate takeover. You built up something which you have you're personally invested in. You have your kind of ethical framework that you like to work within. What is it that makes people go into this then? Is it a money thing? I mean, what's the kind of the deal here?
I think that the people just feel fulfilled and they feel like work isn't work when they come. Like they work, and the people that work with us, they work hard. But the biggest thing that we like to focus on is like we're all a team, and it's not like we're the doctors in the white coats that come in. We wear green coats, and we are kind of like equal with the staff. And I think that just makes people feel like valued and important, and that they have like just as important of a role, whether it's the front desk that greets the patient when they come in, whether it's the assistant that walks them in the back, whether it's the hygienist that cleans their teeth, or the doctor that checks their teeth. Like everyone in that office creates this experience for these patients, and I feel like collectively it just it sets us apart and it makes us unique.
Okay. And how have family expectations and awareness of oral health changed in recent years from your perspective?
I just feel like there is a lot of stuff on social media now, a lot of stuff on TikTok, a lot of new changes in, guidelines on fluoride, a lot of new products that come out that just try to make things easier for kids. And so there's this like weird toothbrush thing that they have in 2 different sizes, and you're supposed to just like put it in your mouth. It's like a mouth guard, and you just lay it there, and it's supposed to just like brush your teeth for you. But everyone has a different size mouth and it doesn't fit everyone's mouth the same. So it doesn't brush the whole tooth. And so people are just looking for something like this to make it easier to brush their kids' teeth. But it's like, all you need is a toothbrush, the soft bristle toothbrush, and the right amount of toothpaste. And you could do the same thing for 2 minutes. And I just feel like people are kind of looking for like easy way out, looking for a mouthwash that'll just prevent cavities. But it's like, just brush your teeth for 2 minutes, twice a day. So, eat a good diet. Some people have prone to cavities, but, for the most part, these like new technology things are just a waste of money.
Basically gimmicks is what you're saying.
Yes. Yeah, and they look cool and like the kids want them, but it's like, no.
Are there any challenges unique to serving underserved populations that you wish more providers understood?
That's a good question. Just dealing with insurance companies, just dealing with like what you can bill, collecting, it's difficult to get these patients to show up on the schedule. You can't charge them if they don't show up. You also don't want to overbook because you want to deliver the same great experience to everyone. So it's definitely a challenge, especially because our office sees about like 85% of this underserved population. But I wish other providers understood how rewarding it was to not to sound judgmental, but like discriminate, for lack of a better word, or just to kind of like serve any patient that walks through your door. Like they're just another human being with like a need. And obviously there's people that we can't see, there's financial limitations to things, but we really do our best to work with like payment plans, what the parent can afford that day, and just figuring out something for them. And I just wish a lot of the providers, I wish everyone would see everyone, you know what I mean? Because it's not always the kid's fault that they're in that position. It's just, so you kind of have a little bit more empathy for it when they show up an hour late or, something like that can be frustrating to your day.
I presume you don't do this because it's harder work, perhaps not as lucrative, perhaps, as the work you're doing. I'm just
exactly.
trying to understand.
Yeah, it is. That's exactly what it is. It's, I feel like I don't want to like say it like that because a lot of people in, bigger cities, more affluent areas, they can like charge cash basically. And they have people coming to their doors and they're busy and they're full. But like in our practice, like just we are so focused on efficiencies and systems and just maximizing time and maximizing, it's not necessarily that I need to do all the things. I have trained assistants and trained hygienists that can help me. And I think that makes me more efficient and that makes me able to serve more patients. So essentially it's like, the money comes if you're just efficient and you do the right thing for the right reasons. So I feel like I'm very, happy with the results of what we do. So I wish other providers could see that too.
Actually, on that subject of efficiencies, can you talk a little bit about the way in which your practice has used technology or digital communications to get these efficiencies? Because clearly the kind of the area that or the model that you're in, you've got to be efficient because you have got all these other bottlenecks elsewhere. There's a whole thing with insurance and billing and what have you. How have you used technology to help?
So our insurance and our billing, some of it's done in office, a lot of our insurance stuff, but we've used a lot of insurance verifications that are AI. We do a lot of our billing through a third party that is remote. All of our inter-office communication is all digital. We don't leave Post-its on people's desks. We use Slack channels. Obviously, our software is digital x-rays. And a big thing is we use like digital inter-office communication where we kind of send messages to each other, and that's like on every computer. So for like every stage of the appointment and like every single room, you kind of always have a pulse on what's going on. And there are hygiene leads, there are clinical assistant leads that guide the doctors where to go. All the appointments are really staggered in 10-minute intervals. So it's like, a patient comes in at 2:00, at 2:10, at 2:20, and it's a 1 hour blocked appointment, a 30-minute and a 30-minute. So kind of as you're finishing up one, you're starting the next. And it's just kind of like, it's just this flow that you get into once the day starts, where you're just working very harmoniously and you have team members to help you. If you get stuck somewhere, you have the other doctor to reach out to, hey, I'm stuck in this room. This patient's taking me longer than I expected. Can you cover for me for 5-10 minutes? And there's always kind of that person to do that for you. So it's just makes things work very well.
Brilliant. So what would you say is perhaps one of the biggest challenges you've had to overcome in getting to this point where you've got all these efficiencies in? What's the kind of biggest thing that you've had to solve to make this operation what it is today?
That's a good question. I think a big thing that kind of pushed us in a good direction is having someone else that we can trust manage a lot of the administrative part and the human resources part, because as we were growing, there's employee reviews to do, which we used to do. There are a lot of the hiring, firing we used to do, and we used to waste a lot of energy and tension on those conversations. Like, at the end of the day, you're going to have to fire this person and you don't want to, and you have something written up, but then, you have to read it at 5:00. And I just feel like that's draining in the afternoon when you have a patient that came in an hour late, they're not cooperative, and mom wants the work done anyway. And then, you have to fire this person at 5:00. So that was very stressful. And I feel like now having this person in place who manages a lot of this, who works with a lot of these leadership teams and not having to do these things, really helps me just focus on providing the dental work.
So it's about the team, really. You've got the right people in there to kind of support your whole process. Who are the key players then? I mean, you mentioned HR. Who are the other kind of main players in your kind of management team that really make things work for you?
Yeah. So in each office, we have like 2 leads, we call them, and they work together kind of like in a yin yang kind of relationship where they, work with each other's strengths, with their weaknesses. One person's good at managing call offs in the morning. The other person has to get her kids to school. So they work together very well. Then this other person maybe can stay a little later and do the ordering versus the other person has to kind of get out. Just little things like that. And each office has this dynamic, and they're like the go-to people that if you have a problem, if you have a question, if a team member has an issue, like the assistant doesn't go directly to the doctor. The assistant goes to their lead first with the question. And if the lead can't answer it, it gets escalated to the doctor. But it just helps streamline and keep things efficient, minimize the drama, and just makes everything pretty standardized. And the more standardized we are, I think the more simply things flow and things just kind of start to make sense. So once we have these like go-to people for these assistants, these hygienists, these front desk people, then that really just takes a lot off our plate.
So you've got this team in place, you've got various efficiencies in the way that you run your operation. Is there anything that you haven't quite solved yet? Anything which is a bottleneck or a challenge for you and your colleagues?
I guess it's people kind of falling back into their old habits. We do a lot of leadership training, a lot of mentoring, but we want to see people grow within the company, start off as like a sterilization tech and then grow into a finance role. We want to see an assistant go to hygiene school and, continue her career. But sometimes there's people that just fall into like old habits. And as much as we try to tell them, be patient, your time is coming, people just like want more and they're impatient and they want it now and they want more money because, there's all these jobs on Indeed and they find out they can make $5 more if they go to the office down the street. And then they come to us and they're like, I'm going to go here if you don't give me this, like just very demanding. And it's like, whoa, like it's not going to be the same there. Then go. You know what I mean? Like, and I just feel like there's a lot of that, just like, I don't know, lack of respect or just lack of patience. And that like generation below mine, I think, where people just like want it and they want it now and they think they deserve it. And it's like, I showed up to work for the last 4 days, like I deserve a $5 increase. And it's like, no, you don't. So just a lot of like managing that, just expectations, and just that like other generation that I'm just beginning to see kind of come through. So.
Got it. Well, in a similar vein, if there was if you had a magic wand and you could fix one thing in your practice tomorrow, what would it be? Would it be that, or would it be something a bit more fundamental?
Probably not that. It's definitely just probably more of like a current issue. I don't know, like there's like a different feel in each of the offices, and it's just like different personalities. Some of the offices that we've had, two of the offices that are like our first offices, I just feel like function in a different way than the other two. And I don't really know what that is necessarily. They're like only a half an hour, 40 minutes apart from each other. So geographically, they're very similar. I guess I would love to just like standardize things and have someone come through and kind of make these protocols. But sometimes in like trying to standardize things, making these standard operating protocols, sometimes we make things more confusing. So I guess just finding that like balance of standardization, but also clarity. And just like having all the answers for like all the problems that we have like right now, like, I don't know, there's like too many calls coming through, or the patients aren't filling out their forms. What's the best like AI to do that? Like, what's the best software? And everyone wants to advertise all these different platforms. And then you're like comparing them all and you don't know it until you try it. So it's almost like if there was just like a wizard that could just come in and like wave a wand and identify the problems without even having to identify them would be the solution.
I mean, how easy is it to keep a handle on, I think you had 4 offices, don't you?
Yeah.
They're close, but still geographically disparate. I mean,
yeah.
How easy is it to keep a handle on everything that's going on across 4 sites when, you're working, you're pretty busy yourself in the work that you do?
I mean, it's definitely challenging. It's something that like, if I don't go to one office for 2 weeks, I kind of feel like I know I haven't been there. So it's definitely has its challenges, but I think we're moving towards offering more doctors equity opportunities. And I think that makes us unique, because if we have this lead doctor that's invested in the office, I think that helps keep things in check a little bit better. And I think that makes us unique, because a lot of these bigger offices, they might want to like pay big salaries to these doctors, but people like to feel like they're part of something, and that like what they say or do matters. And I think it's very unique for our office to have like 7 or 8 pediatric dentists, doctors, females that all collectively want to work together, and we don't get frustrated. And we're like, well, I don't care what you like. I don't like what you're saying, so I'm just going to go open my own office down the street. I think that is very unique, because we all know that we're better together than any of us would be separately. So I think that is the direction that we're really trying to like focus on. So offering other doctors these ownership opportunities is definitely a way to like kind of stay ahead and keep a pulse of what's going on, because you put someone in charge that you really trust and cares as much as you do.
I hear you.
So
it's obviously a massive need for what you do, but if you had a sudden influx of 100 patients next week, what would be the first thing to break? And don't say you.
I don't know. I feel like we have the rooms. I think the assistants and the staff, I think we just like need more manpower. We just need more like people to clean and sterilization. We just need more people to answer the phones. We need more people to check them in. We need more iPads. We just need more manpower. Because I think our offices are not running at their complete full capacity, because it's just like there's like the hiring that you just can't keep up with and turnover of employees. So I think that just manpower.
Okay.
Yeah.
And obviously it's been a journey in what you've created, which is incredibly impressive. But if you were to do it all over again tomorrow, knowing what you know now, what would you do differently, if anything?
I mean, honestly, I don't know if I would do anything differently. I one of the biggest things is I really like doubted coming back to this area, which is like my hometown. I knew I always wanted to come back, but I was scared that when I did, if I didn't make the right decision in the right practice, that all of the like non-competes and contracts and all these problems would come to fruition, because I just assumed that I would like leave at some point. But I kind of always envisioned having like my own office, and I always thought it would be smaller. I never thought that I'd be like a part of something like this. And I just feel like having this big of an office with all these doctors also gives me like a ton of flexibility just to be a parent, to see my daughter for dinner 2 days a week, to see my husband, just to kind of do all of those things that are also really important to me, have time with my family, because other people are managing a lot of the administrative work. So I think that, I always would say like, oh, I could have done this on my own. I could open my own office. I could have 10 great employees and have this tiny little office. But I don't think at the end of the day, like I would have just been like happy with that. There'd always be something else that I was chasing. And I feel like now this like growth, this ability to serve more patients is just exactly where I'm meant to be. So,
what do you look for in terms of metrics? Obviously you're a business owner, you've got 4 sites, there's lots of things going on, but what are you most focused on when you're looking at how things are going in your business from a metric point of view or outcome point of view or anything else?
That's a great question. That is something that we are really working on, kind of this idea of a scorecard and having these, 5 to 10 metrics that if we were on a deserted island, I could still know how my practice is operating. I feel like this was never really like a problem before, but maybe in the last like 6 months, we've kind of realized we're not necessarily like operating as efficiently as we could, maximizing each office. I mean, I feel like metrics right now that we focus on, we're just very much focused on like the good and the patient experience and the staff experience. I mean, we look at Google reviews. Just getting really good reviews is like a really big deal. We share those with our team. I think we do a good job at not getting a lot of bad reviews. If we get a bad review, which we do, like we deal with it. We talk to the parent. We say, what can we do to make it better? Or if it's just irreconcilable, then we just try to improve our system. So I think that's like a good metric that we've been using, and just like staff satisfaction. We were trying to do more like surveys, more check-ins with our staff and make sure they're happy. They don't feel overworked. They don't feel underappreciated. So that's a big one. And then as far as like from like a financial standpoint, that is an area that we are working with a lot of different like AI softwares now to kind of come up with these measurable goals and figure out what those numbers are. So we're working towards that.
Cool. And what's for the future of Sprout Pediatric Dental, perhaps over the next 6 to 12 months? Where are you looking to take things?
I guess we would really like to have each of these offices like operating very efficiently. And then with the idea that, let's say we find another doctor in another remote part of our state, we can open up another location, maybe an hour or 2 away, a little bit further away. And ideally you could say like, oh yeah, have like a Sprout office everywhere, kind of like a Chick-fil-A or a McDonald's, but that might not be as possible. But obviously it could be like a big goal. But I just think as we grow, as we have more locations, just maintaining that, like our same core values, our same ethics, standards, and just not growing too big where we kind of lose control and quality goes down. So quality is very important.
Of course. And finally, is there a change that you would like to see in pediatric dentistry nationwide, if you could name one?
I know there's a lot like going on now with like sedation, anesthesia guidelines, what's covered by insurances, what's not. I know currently a lot of times the anesthesia for providing like dental treatment in a hospital is not covered because it's deemed not medically necessary. And I just feel like it is medically necessary, because like the alternative is like holding a kid down and like doing treatment when they're not cooperative. And so I think that makes things like very prohibitive to a lot of parents. I think it's just like that access to care. It's like whether it's like a financial impediment, whether it's, a location that, transportation issue that they can't get to. I think that those are big problems. And I just think increasing that access to care would make things better and help kids have like better experiences and prevent a lot of problems.
Alesia, thank you so much for your time this afternoon. It's been wonderful talking to you, hearing about what you've created, the journey, the inspiration, what you're doing in terms of serving underserved populations. Quite remarkable, and I'm really grateful for the honest conversation. So thank you so much.
Thank you. Thank you for the opportunity.